Hello and welcome to The Explainer. Today we are diving deep into a topic that affects millions of us, heart disease. And I've got to tell you, what we're about to unpack might just flip the script on everything you've been told. So let's just jump right in with a question. You know those calcium supplements tons of people take, thinking they're doing their bones a favor? Well, what if I told you they could be doing more harm than good? What if they were actually putting you at a higher risk for a heart attack? Yeah, a 20% increased risk of heart attack or stroke. That's not a small number, and this comes from the work of our source for this explainer, cardiologist Dr. Jamnadas. So it kind of begs the question, right? If something we thought was helpful is potentially this dangerous, what else have we gotten wrong about what really causes heart disease? It's pretty clear our conventional wisdom has some holes in it. So it's time to go deeper. We're going to investigate this, drawing on Dr. Jamnadas's 3 decades of clinical experience to uncover what he argues is the true root cause. Here's our game plan for today. First, we'll pinpoint the real culprit. Then we'll meet the 4 villains that feed the fire. After that, we'll explore a powerful solution involving a 36-hour fast, and we'll wrap up with some simple, everyday hacks that can make a huge difference. Okay, let's get into the thick of it. For decades, the big, scary monster in the closet has been cholesterol and plaque. But what if that's just a symptom, not the disease itself? And here's the core idea from Dr. Jamnadas. The bottom line is inflammation. It's not just about having plaque in your arteries. It's about that plaque being inflamed. That's what turns a chronic condition into an emergency. You can think of it like a pimple on your artery wall. The pimple itself isn't the catastrophe. The disaster happens when it gets angry, red, and inflamed, and then it bursts. When that happens inside an artery, the body forms a blood clot to heal the wound. And that clot is what blocks blood flow and causes the heart attack or stroke. So, where does all this inflammation start? Well, it begins with damage to this little-known but absolutely critical layer called the glycocalyx. Picture it as a super delicate, non-stick, Teflon-like coating that lines all of your arteries. It's your first line of defense. But our modern lifestyle, with its high sugar, all the toxins we're exposed to, and problems like a leaky gut, it's like taking sandpaper to that delicate lining. It just wears it away, leaving the raw artery wall underneath totally exposed and vulnerable. And once that wall is exposed, it gets angry. It sends out these little grabby hands, what Dr. Jamnadas calls Velcro. These are adhesion molecules that just stick out and start snatching damaged particles that are floating by in your blood. And that's the beginning of a plaque. Okay, so inflammation starts the fire. But what's the fuel? What are these damaged particles that get stuck on the Velcro? This is where cholesterol enters the story, but probably not how you've heard. LDL cholesterol, the bad kind, is actually essential. The problem is when it gets damaged. So let's meet the 4 main villains responsible for that damage. Dr. Jamnadas highlights these 4. First, there's too much glucose, which literally candy coats the LDL particles, making them sticky and dysfunctional. Second, you have unstable omega-6 seed oils from all our processed foods, which make the LDL particle itself oxidized and rancid. Third, toxins from things like overcooked foods. And fourth, bacterial toxins called LPS that leak from an unhealthy gut. Your LDL is like a janitor, trying to clean up all this garbage, but it gets damaged in the process. And this leads us to a massive contradiction. For more than half a century, the advice was simple: cut fat, cut red meat, save your heart. And we listened. We cut red meat consumption by half. We slashed our fat intake. But coronary artery disease rates didn't drop. They kept climbing. It's a pretty glaring sign that maybe, just maybe, we were aiming at the wrong enemy all along. So, if the real problem is this fire of inflammation, fueled by all these villains, what's the fire extinguisher? Well, Dr. Jamnadas argues that one of the most powerful tools we have is actually an ancient one: fasting. It's a way to give your body a complete break to clean house and heal itself from the inside out. See, a fast is more than just not eating. It's a profound metabolic shift. Around 12 hours in, you've burned through your stored sugar. By 24 hours, your body starts producing ketones. But Dr. Jamnadas calls 36 hours the magic point. That's when your body is really churning out ketones, which are a super clean anti-inflammatory fuel for your brain and body. And the beauty of fasting is that it's not a single target drug. It's a system-wide reset. It directly lowers inflammation. It gives your gut, the source of some of those toxins, a chance to finally rest and heal. It reboots your gut bacteria, and it floods your system with clean energy. It even helps break that psychological need to eat all the time. It hits all the root causes we just talked about. 183. What is that? That is the number of consecutive days one of Dr. Jamnadas' patients fasted, under very close medical supervision, of course. Now, this is an extreme case, no doubt, but the results, they were jaw-dropping. A complete reversal of his diabetes and high blood pressure. His chronic joint pain, gone. It's just a stunning example of the body's incredible capacity to heal itself when given the chance. Okay, a 183-day fast is obviously not for everyone, but it's not an all-or-nothing game. Let's talk about some other simple, powerful strategies you can add to your health toolkit. So, let's circle all the way back to that calcium question we started with. Dr. Jamnadas' advice is crystal clear. Avoid the elemental calcium supplements. If you want strong bones, the answer isn't just more calcium, it's resistance exercise, making your bones work. And pair vitamin D with vitamin K2, which acts like a traffic cop, telling that calcium to go into your bones, not your arteries. Here's another amazing hack. It's all about your vagus nerve. Think of this nerve as the master switch for your body's relaxation response, the rest and digest system. By stimulating it, you can actively pull yourself out of that chronic, stressful fight-or-flight mode that so many of us live in. And the best part is hacking this nerve is incredibly simple. You don't need any special equipment. You can do it right now. Just take a few deep, slow breaths, making your exhale longer than your inhale. That's it. Or try humming a tune, having a good laugh, gently massaging your eyes. Even a quick jolt from an ice pack on your neck can do the trick. All these things increase your vagal tone, which calms your entire system and fights that root cause problem, inflammation. So we'll leave you with this final thought. The case Dr. Jamnadas makes is that heart disease isn't a plumbing problem, it's a fire. It's a disease of inflammation. And it forces us to ask a really important question. Have we spent the last 50 years focusing on the smoke, the cholesterol, the plaque, while completely ignoring the fire that's causing it all? Thanks for joining us for this explainer.